have a really favorite stretch for the small glutes and also the lateral line of the leg. You can grab the ankle nicely, and I'm just cupping it. I'm not holding it tightly. I'm just letting it rest right in my hand. My fingertips are not engaged. And I can draw this gently across the body. The goal here is that you don't tilt the pelvis with it. And so you may have to ask, can you see if you can drop your right hip onto the table? Good. Now the other thing you'll notice as you do this is that her foot will start to want to invert, and I can actually draw it into eversion to increase the stretch down there. Now I'm basically going to allow those small glutes, glute medius, glute minimus, to kind of slowly get used to this. I can traction away to make sure she doesn't fire her QL to protect all that. And I can just very gently move this over like this, keeping her from pointing the foot, keeping her from inverting the ankle. And that just helps stretch this whole lateral line of her leg. Now, if I wanted to make this active, I can now ask her to try to resist me by basically trying to draw her leg back across that way while I resist her. So drop your leg. There we go. Okay, so I've got her here. I've got a nice stretch going. So I'm going to have you try and push your lateral malleolus out that direction, making sure to keep the right hip on the table. There you go. And you should feel that right in your side hip, the small glutes. And you can give a count, or you can just kind of feel it out for about 10 seconds and then ask her to let it go. And go ahead and release that. And as she releases it, you should feel like you can very slowly and gently increase until you feel a little resistance. And now I'm going to have her fire again, trying to push this lateral malleolus out that way. 5, 4, 3, 2, 1, and release it. And then you don't want to try to shove through as soon as they release. There's like sort of a period where it needs a second to let go, and then you'll feel it start to want to open up more. And we started with her basically being able to maybe get to this angle, and now we've already gotten her more open. So I'm going to have her do that one more time. Good.